Good morning, everybody. My name is Leunora Okubasu, and I currently work as the procurement and supply chain management expert for the Global Fund Local Fund agent in the Kenyan portfolio. I am a pharmacist and a very, very enthusiastic global health supply chain specialist who has worked mostly in developing country contexts. Naturally, my leadership project will be hinged on the Kenyan public health supply chain system, and which is usually operated by pharmaceutical staff. In the recent past, we've seen that the supply chain management as a discipline has undertaken a positive steps towards professionalization, seeing a rise of individuals who pick it up as a solid career path across various sectors, including the health industry. However, within the healthcare space, we still see a disparity of the ratio of males to females who join and excel within the supply chain management profession to leadership roles, despite there being about 1-to-1 female ratio with the pharmaceutical staff that run the Kenyan public health supply chain system. So therefore, the topic of my leadership project is understanding the funnel. Why are there disproportionately fewer women in health leadership roles? This is a qualitative study, and the study population is women in health supply chain leadership in Kenya. The main aim of the project is to look at the role or explore the role of mentorship in inspiring professional growth of female health supply chain specialists in Kenya. I have 3 objectives, and the first one is to identify and characterize the domains of mentorship along the professional growth journey. Why do we want to look at the domains? Because we feel like mentorship not only targets the hardcore skills of the individual, but also provides other aspects that help the individual to develop staying power within this challenging professional context. The second objective is to identify facilitators and barriers of mentorship in this journey, and the fourth objective is to propose a framework for structured mentorship for optimal professional growth. This morning, I'll be sharing some preliminary findings on the first phase of my project, which is a literature review around mentorship for professional development. The first one is looking at mentorship as a tool for the shaping of a progressive professional. Literature defines a progressive professional as one who is intentional, is sufficiently courageous, and is open to change. However, literature does not have a solid consensus as to what one crystal definition of mentorship is, but notably, it describes mentorship as both developmental and relational, and it is also a tool for deep equitable learning with social transformative value, and that it can either be formal or informal. The functions of mentorship are broadly seen as: 1, career development to enhance the actual technical skills of the individual; psychosocial development, sort of helping the individual to develop self-efficacy and the staying power within the profession; and then the other function is structural navigation, which helps the individual to develop capacity to understand complexities and enable them to navigate institutional cultures. And the fourth function is mutual learning, which now helps to build the capacity of the mentee to be able to drive learning and between themselves and the mentor. So therefore, my argument is that function determines structure, and for these 4 functions, I extract 4 domains, and these are the cognitive and psychomotor domain, the affective domain, institutional and cultural intelligence domain, and reverse mentorship domain. With these 4 domains, I propose that this framework is the one that I will use to investigate the phenomenon of mentorship as a tool for professional growth and propose a future state structured framework for mentorship. My leadership project has both stretched me, it has helped me to grow, it has challenged me in various ways. Notably, I have been able through a topic that is near and dear to me, and that is mentorship. I've been able to uniquely voice print a health system change within the Kenyan context, and it also will be able to shape how we mentor upcoming supply chain leaders for the future. The leadership project has also helped me to develop consciously and to think consciously about the aspects of inclusivity. I have learned that effective mentorship should be equitable, inclusive, and socially just. I am also learning to overcome role strain while remaining effective across all the different roles that I play as an individual and as a woman in the healthcare, as a woman leader in the healthcare space. And I've also gained a group of women that I can keep me accountable to enable me to keep on track and finish my leadership project so that we can actually make meaningful and definitive change in the health system. Thank you very much for listening to me.